welcome to X-ray Review. So what is this? There's a large white density seen overlying this lumbar spine and pelvis, and this video is about what this density is and multiple examples. This X-ray is of a middle-aged female who presented with lower back pain, and you can see a large homogeneous density in the expectant area of the large intestines. And this is from a previous barium enema and a residual contrast from a previous lower GI exam. So this contrast can stay in the body for hours to days until it works itself out. So if the patient has any other types of imaging, such as this X-ray done, that this residual contrast can be visualized, and you don't want to mistake it for some type of osseous lesion or tumor. Rather, understand that this is residual contrast from a previous lower GI exam. Here is another example of previous contrast examination of the lower GI, resulting in this residual contrast still visible on an X-ray. And some of the reasons that a physician might order a lower GI study could be to evaluate things like polyps or cancer, and also to look for things like inflammatory bowel disease. This patient has small amounts of residual contrast seen in the lower GI, and sometimes this type of pattern and distribution can be suggestive of an underlying abnormality such as diverticulosis. And here's one more example of residual contrast from a previous lower GI study, and you'll notice that this density overlaps both the bone and the soft tissue. So this is not some type of osseous lesion, it is overlying residual contrast. So whenever you see this with a patient, it's always best to figure out what that previous study was for and if there was any abnormal results from that examination. Alright, and hopefully now you know what residual contrast looks like on an X-ray from a previous lower GI exam. If you enjoyed this, please like and subscribe, and if you have any questions, please let me know. Thanks again.